Hello there. If you're watching this, chances are you're worried about your dog. I mean, seeing them limp or favor a leg, it's just awful, right? It can really tie your stomach in knots. But take a deep breath. We are going to walk through what that limp could mean, what you should be looking for, and how we can help get them back on all four paws.
It is just the worst feeling, isn't it? You see them limping and your mind just starts racing. You know something is wrong, but you have no idea what it is or how serious it might be. Well, the good news is you are in exactly the right place to get some clear, straightforward answers.
Okay, let's dive right in. The very first thing to get your head around is that limping, or what we vets call lameness, isn't a disease itself. Think of it more as a big flashing sign, a really important one, that your dog is dealing with some kind of underlying issue.
So what is lameness, really? Well, it's your dog's way of saying, hey, something over here hurts. It's their body's built-in defense mechanism, telling them, hey, don't put weight on this, it's not stable, or it's painful. It's really no different than you limping if you stepped on a piece of Lego in the middle of the night.
Now, this gives us our first major clue. Did the limp just pop up out of nowhere, or has it been creeping up on you? A limp that appears suddenly after a wild game of fetch, well, that usually points towards an injury. But a limp that kind of slowly gets worse over weeks or months, that often signals a more chronic condition, like arthritis or maybe something like hip dysplasia. Figuring out which one it is, sudden or gradual, is a huge first step.
So what could actually be causing the limp? The source of the pain can be anywhere, from the very tip of a toenail all the way up to the shoulder or the hip. And while the list of potential causes is pretty long, they generally fall into a few main categories.
The cause could be something really simple, like a little thorn stuck in a paw pad, or it could be something more complex like a torn ligament in their knee. For our older dogs, arthritis is a super common culprit. And in growing, big breed puppies, we sometimes see this weird, temporary but painful bone inflammation. So you can see just how wide-ranging the possibilities are.
Okay, this is where you come in. Seriously, you know your dog better than anyone on this planet, and what you observe at home is incredibly valuable information. You get to be the detective on the scene, gathering all the essential clues before you even step foot in the vet's office.
First up, just watch. How are they walking? How do they get up from a nap? Then, if your dog is okay with it, start with the paw. Look really closely between their little toe pads, check each nail. From there, you can gently run your hands all the way up the leg. You're feeling for anything that seems different from the other legs, like any heat, swelling, or a spot that makes them flinch. Now, the golden rule here is to be gentle. If your dog shows any sign of real pain, you stop immediately.
Sometimes the clues aren't even in the limp itself, but in their behavior. Are they suddenly not wanting to jump on the couch anymore? Are they extra stiff when they first get up? And a dog that constantly licks one spot, they're often trying to soothe pain in that area. These are all subtle, but really significant signs that something's up.
Now, we need to talk about this because it's so important. While most limps can wait for a regular vet appointment, some absolutely cannot, and it is vital that you know the difference.
Okay, listen up. If you see any of these signs, a leg that's at a totally unnatural angle, if they are crying out in pain, or they just can't stand up at all, this is an emergency. Do not wait. Contact your veterinarian or the nearest emergency clinic right away. Same goes if the limp is paired with other really serious symptoms, like a high fever or vomiting.
All right, so you've made the appointment. I know heading to the vet can be stressful for you and for them, but knowing what to expect can make it a much, much smoother process. Think of this as a partnership. You're bringing the clues you gathered, and your vet is bringing the diagnostic tools to put it all together.
Your vet is going to start by asking you a bunch of questions, and this is where all your detective work really pays off. Then, they'll want to watch your dog move. A cool little trick we use is watching their head. If a front leg is sore, a dog's head will usually go up when that sore leg hits the ground. After that, it's time for a hands-on exam, where they'll carefully feel each part of the leg and check how well the joints can move. Sometimes that physical exam is all it takes to figure out what's going on, but pretty often, especially with issues that are a little more subtle or complex, the vet's going to need to look inside to get the full picture.
To get that deeper look, we've got a few tools in our belt. X-rays are the most common. They give us a great picture of bones and joints. Blood tests are fantastic for screening for things like tick-borne diseases or signs of inflammation in the body. And for those really tricky cases, we might need advanced imaging, like a CT scan or an MRI, to get the final answer.
And hey, if your dog needs x-rays, don't be surprised if your vet recommends sedation. It's actually a really good thing. It helps them get a perfectly still, clear image, and, most importantly, it makes sure your dog is comfortable and totally stress-free through the whole thing. It's all about their comfort.
So, once you have a diagnosis, we can finally focus on the most important part, the path to recovery. And the key thing to remember here is that no matter what the cause is, there are always options to manage pain and improve your dog's quality of life. There's always hope.
Treatment is almost never just one thing. It's usually a combined approach, kind of tailored specifically to your dog. This can include pain medication, lots of rest, maybe even some physical therapy. And for chronic issues like arthritis, managing your dog's weight can have a massive impact. I mean, think about it. Every extra pound adds strain to those sore joints. And of course, in some cases, surgery might be the best way to get them back to their old selves.
So, if there is one thing I really want you to take away from all this, it's that a limp is a puzzle we need to solve, not a final verdict. Through your own careful detective work, a solid partnership with your vet, and a good treatment plan, you can absolutely help your best friend live a comfortable, happy, and active life.
Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.